Today's quality measure is breast cancer screening. This presentation is about supplemental data, not claims nor diagnostic imaging reports. As an overview, the denominator includes members 50 to 74 years of age, including all payers. There has been a HEDIS change from women to members. Such members include administrative gender of female, sex of female assigned at birth, and sex parameter for clinical use of female. All may occur at any time in the member's history. For the numerator, per HEDIS, it is members 50 to 74 years of age who had a mammogram to screen for breast cancer every 2 years. More specifically, the look-back period is 27 months. For the 2024 measurement year, mammograms must be completed between October 1st, 2022 to December 31st, 2024. This measure excludes patients who had hospice or palliative care services or are deceased, women who had a bilateral mastectomy or had a right and a left unilateral mastectomy, and documenting, quote, bilateral mastectomy in 1999, unquote, is specific enough to determine that this exclusion occurred on or before December 31st of the measurement year. Lastly, members who had gender-affirming chest surgery with a diagnosis of gender dysphoria at any time during the member's history may be excluded. Following are required for documentation: a note in the medical record indicating the date, month/year, type, and the result of the breast cancer screening. A few types include screening, diagnostic, film, digital, or 3D, and documenting the findings as normal or abnormal. Mammograms may be patient-reported so long as documentation includes date, type of test, and result. Documentation can be completed during a telehealth encounter. An example may include, quote, mammogram 7/2023 normal, unquote, though it is recommended to document as month/day/year if possible. Common insufficiencies include biopsies, breast ultrasounds, or MRIs. These do not meet the measure. Utilizing patient questionnaires that do not capture the type of screening, or the patient does not provide complete information. Failing to document the findings, i.e. Mammo 10/2021, and terms like last year, last month, or recently are not acceptable. Here is an example of an office visit note. If you see here below circled in blue, it states mammogram recently. But what is missing? As we know, we need 3 different elements. Mammogram may be considered as the type, but recently is not specific enough for the date. And lastly, we are missing the result of normal or abnormal. Let's review best practices. On annual wellness visit forms, include breast cancer screening questions. If a patient received a wellness evaluation within the last year, use Z-code Z1231. It may be used in place of a follow-up appointment. The patient can call the rendering provider to request an order and go straight to diagnostic imaging for a screening. Upload mammography reports into your EMR and label clearly for easy identification. Set up notifications in the patient's chart to remind providers of when a patient's next screening is due. Make follow-up phone calls if patients have not completed their screenings. Educate patients on the risks of breast cancer, and use Arizona Care Network's Care Coordination Team as a resource. Continue working with your clinical performance consultant and use ACN's additional resources. Visit Arizona Care Network's website for the 2024 tip sheets of all the quality measures. This concludes the breast cancer screening training course. Thank you for listening.